All right, I'd like to start talking about nebulized treatments and different oxygen requirements, things like that. So some of the things I want to cover, first of all, is this machine. This machine is the patient's. It belongs in the resident's room. It does not come out. It does not go into anybody else's room. It belongs to the resident, so leave it in the room. When it comes to this tubing, the tubing is one of those things that you are going to be changing out. If you're giving the nebulized treatments as a medication aid, this is part of your job, okay? So you need to change this tubing out according to your facility's requirements, whether they want it changed once a week, once every 10 days, 2 weeks, whatever their requirements are. My recommendation is if you take a Sharpie and write along the tubing the expiration date, then it's kind of clear and easy for everybody to see when does this tubing need to be changed and that it is being changed regularly. I also know there's some places that have a little paper tab that can go on here that tells you exactly when to change those. So I want to go on and talk about the nebulized treatments, the equipment that you need. We have different breathing treatments and things that we'll also discuss. So we're going to start out with setting up the nebulizer for nebulized treatment. So there's several methods that you can do this. There are different nebulizer equipment. There's this one little nebulizer cup. It almost looks like a little egg cup with a lid. And the inside piece looks like a little tower. So that goes inside of there. Then you would put your medication in. Then you put the lid on, okay? And then you would do your nebulized treatment with this kind. But like I say, there's different ones. The one I'm going to use today is this one. So ours is a kind of just a round one. It has a green disc like this that goes in. It sits right on top there. Again, then you would put your medication in it. This is your, whether it's your albuterol, whatever your doctor has prescribed for this resident. A lot of times they come in packages like that. Inside the package is five, I think usually 5 or 6 of these. Okay, so then you would take the top of it off, and this whole tube is one treatment. So you're going to squeeze the whole thing into here, and you want to administer that. So you've got it in there, you've got your medication, you're going to put your lid on. Then you're going to use your T-piece. Now there's 2 ways to do it. You can do breathing treatment with a mask only, or you can do it with what I call, it's like the pipe method. It kind of looks like a peace pipe to me, that's why I call it that. So I'm going to set the pipe method up for you first. So you've got this little T-piece that goes like this, sits right on top of here. And then you've got, this is called a reservoir. It's kind of an accordion type material, plastic, and it holds some of the medication in here so you're not losing it all into the air. And then there's the mouthpiece, and the mouthpiece is going to go right on this end. Of course you want to line it up with their mouth. Normally they put their teeth on this part right here to inhale, okay? So that's what we're going to do. I'm going to set this up and show it to you. All right, so I'm going to go ahead and attach the tubing from the machine. On the side of the machine, again, the machines are all different. This one happens to have an on-off switch right here on the side. I'm going to turn it on. So what the machine is doing, it's taking that medication that you put in there and it's breaking it down into this fine, fine mist. This is what you want them to inhale, okay? So when you're using the pipe method, you want to make sure that they put their mouth on this piece and you want them to inhale deeply, okay? You want that mist to disappear. If it doesn't disappear, they're not doing a good job of taking a good deep breath. Because if they're doing something like this, they're not doing the breathing treatment properly. So you want to make sure that you see that mist disappear, okay? Then the other method that we can use is a mask method. It goes on just like you've seen. This is what most people are familiar with in long-term care, is the mask method. And so then this would go around the resident's head and put it on their face, okay? So the problem with this is that a lot of facilities are now asking us to stay with the resident during the breathing treatment. I highly encourage you to. A breathing treatment takes between 5 and 7 minutes. But this is what happens when you don't stay with them, okay? So you come back and you find them asleep like this. It's like, how many good deep breaths are they really taking if they're slumped over and sleeping? The other thing we find is we come back and we find it up here on their heads, right? It's like, when did they put that up there? Did they put that up there 2 seconds after I walked out of the room? So stay with them. Encourage them to do those good deep breaths. You want to do the nebulized treatment until it's completely empty. As the treatment uses up, like I said, it'll take about 7 minutes, but you can keep tapping the side, which releases more droplets, which makes more of the mist. Okay? So you're going to continue this until it's all used. Never throw away any of the medication. Okay? So you want to make sure that it's completely emptied out. Then we also, when we're done with the nebulized treatment, every treatment, not once a day, once every couple of days, or whatever, at the beginning of the day, at the end of the day, after every treatment, you want to wash out components, okay? So you would completely take it apart, you would take it to the sink, take all the pieces, you're gonna wash it in soap and water, and then you're gonna lay it out to dry. Make sure that you wash the mask as well. It's part of the components. It gets buildup of the medication in there, so you want to make sure that you wash all those parts, lay them out to dry because you want them to dry in between. There are several different kinds of masks. This is a pediatric mask. You can tell it's a lot smaller, so it is like for your pediatrics. This is also another kind of nebulizer that hooks up to your machine. This is called a micro mist. And a lot of times this is used for pediatrics, but sometimes they use it in elderly as well. But instead of, this one makes a little bit bigger droplet or mist. This one breaks it down really, really fine so they can get it way down deep into their lungs. Okay? So if you're going to do a breathing treatment, a lot of times there's 2 medications that are combined into one tubing, and that's fine. And you can administer that. But if you have 2 separate breathing treatments, nebulized treatments to give, you need to keep them separate. You cannot put 2 of these, you can't put one medication and another one in the same thing unless you have a doctor's order to do so. So if you've got 2 treatments to do, one of them is a bronchodilator and the other one is, say, a steroid or maybe an antibiotic, you always want to do the bronchodilator first, because your bronchodilator is going to open up those bronchi, going to open up the lungs and get, so that when you do the nebula, or the steroid treatment or the antibiotic, it's going to get all the way down into the lungs. So when you are doing nebulized treatments, if you have 2 treatments to give, always do the bronchodilator first. Then I wanted to talk to you about a couple of other options that we have for breathing treatments. I think most of you are familiar with the inhaler. Everybody, we see them use it. They shake, 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 put it in their mouth like that. Inhale, right? It's not a good thing, okay? Because when they inhale hard and fast like that, it kind of makes the medication stick to the back of their throat, and it doesn't do as good of a job as it should. And on top of that, a lot of people, especially kids, have a hard time, and adults have a hard time compressing it and inhaling at the right time. So most pharmacies, or all pharmacies, carry these. A lot of them will give them to you if you are on an inhaler, because this is the preferred method. So this is called a opti-chamber or aero chamber. There's lots of different names for it, but it's to be used in conjunction with an inhaler. The oval piece on the back fits the oval piece for the mouth. It has a little kind of a very light membrane in there that holds the medication in until they can inhale. So what you want to do with this one is you're going to shake it, you're going to dispense it, and then hand it to the resident to do that nice deep inhale, okay? So this is when people have coordination problems, or in the elderly, in kids, you know, you get it and you dispense it and they're not quite ready to take it. That's going to stay in there for a couple of minutes. It's not going to stay in there for 5 minutes or 10 minutes, but it's going to stay in there a couple of minutes so you have time to hand it over and do the deep inhale that they need to. So these are really, really good as well. Again, this is something that needs to be rinsed out, washed with soap and water on a regular basis. The last one I want to talk to you about is, this one's called a diskette. This particular one happens to be an Advair, but there's lots of different kinds. If you pick up the Advair diskette, there's a little hole right here that gives you a number, and it tells you how many doses are left in the diskette. Ours is right up here in this top corner, right by the thumb hole. So it can always tell you how many doses do you have in this diskette. I'm not sure what they normally come, whether it's like 14 days worth, something like that. But to use one of the diskettes, what you're going to do is you're going to put your thumb in this little slot here and slide it open. So this is the mouthpiece. This is a piece that they're going to inhale on. So you're going to take this and you're going to push it down. And I bring it back up so that it's ready for the next time. So I push it down and bring it up. Then you give it to your resident and they do an inhale on the mouthpiece, okay? What they're inhaling is powder, okay? So if we turn it over after we've opened it and look at it, there's all these little slots inside of there. In each one of those slots is a capsule, like a capsule filled with powder. So when you load it, when you break that down and push it back up, there's 2 needles that inject into that capsule, and that's what opens it for that person to inhale. So you want to make sure that you give them a sip of water or ask them to rinse and spit or rinse and swallow, but you don't want this powder to remain in their mouth or in their throats. It can cause yeast infections, it can cause wounds, all kinds of issues. So please make sure when you do this that you rinse and swallow. One of our residents that we have here for class has one of these. I want to see you offer them a drink of water or to rinse their mouth and spit, okay? So I need to see that you follow this up by a sip of water. So then you can take a damp paper towel or washcloth or something, wipe off the mouthpiece. Then I want you to close it back up, okay? And then it's ready to go back into the cart. So when you're doing your nebulized treatments, just remember that these are very individualized. They belong to that resident. They're not to be shared among other residents. And that if you're going to do your breathing treatments and you have 2 specific treatments to give, always do that bronchodilator first.